Is my screen displaying properly?
We see, I think what you were about to do with the display settings to swap it would have been the best bet. We see the two.
Okay. So swap it, right?
Yep, try that. Yep, that's perfect.
Okay. And I can advance. Okay. Thank you.
Okay, we'll get started in just 1 second since I see it's already 1 o'clock. All right, I'm going to go ahead and get started as I have 101, and I want to be respectful of folks' times, and folks probably got stuff right after this presentation like I do. This is the July EVV Public Forum or Town Hall. I want to thank everyone for attending. I want to thank you for all your continued engagement and participation. We've been doing these town halls since November, and I really do appreciate it. My name is Brian Dowd. I'm the Deputy Executive Director over Policy Operations and Compliance here at the Department of Community Health. Next slide, please.
Working on it. Give me a second.
No worries. Yeah, I don't see a little arrow.
Yeah, I know. Oh, there it is. Got it. Sorry about that.
No worries. We always start every presentation with the mission of the Georgia Department of Community Health, which is to provide Georgians with access to affordable quality health care through effective planning, purchasing, and oversight. So what are we going to go over today? We're going to do what we've done is for these town halls the last couple of months is try and pick out those things which we think are going to be most helpful to the group who joins us for these town halls based on what we get from our call centers, what we get from different partner agencies, what we get from our own staff, just what folks are hearing. We try and cobble that together into a presentation to give you what we think is most impactful and helpful. So we're going to do a little self-directed member update. We're going to talk about key FOBs again. We're going to give you your status updates and timelines. We're going to talk about the benefits of EVV. We're going to talk pretty heavily about the EVV training resources, and I'm going to talk about that again in just 1 sec. We're going to get into some common issues or questions. Then we're going to have Netsmart demo a few things that keep seeming to pop up for you guys to help you with a live demo of a couple of points for their application. Then we're going to give you the call center information, future town halls, third-party update, and a Q&A. Before I move on to the next slide, sorry, Joe, to throw a wrench. Let me talk about one thing, which is EVV training. So there is some misconception that these town halls or work groups are the only training you get. And that couldn't be farther from the truth. These trainings are just one small piece of the training that is available for providers and will be available for participant-directed members as well. So you should not think that all the information on training is contained in these town halls. I have frequently, I probably talk to, in a week, 100 different providers and family members that are impacted by EVV. And that's probably conservative. 100 is probably a conservative estimate. And I'm continually surprised by the number of folks that have not gone to the website, that have not looked at training, that don't have that information and access. And we've been trying we've really been doing town halls and statewide presentations on the subject for over 3 years now. And we have a dedicated website. I went and looked at our Twitter page recently, and there is continuous Twitter updates. There's Facebook updates. There are continuous banner messages for our providers that are available. I have spoke at every provider agency, sister agencies, I have spoken at Facebook groups that members have brought up, and will continue to do that. I've got another one of those next week that's a Facebook family member group. So we continue to communicate in every avenue that is possible, but I don't want folks to think that this is your only training avenue, the once a month town halls, when there is a host of training avenues that are available. And we'll go over that in just a minute. Next slide. So I want to start with self-direction, because through this process, we have heard from many self-directed families who say we need to be treated separately and individually at every single town hall meeting and have our own town halls, which we have fully accommodated. So we're going to talk now about self-direction, and then I'll let you know that after this slide, you can go forward, or actually after the next slide, you can continue to listen to the rest of the presentation to be informed, but you don't have to. So if you are one of the self-directed members, you should be working with your fiscal intermediary for EVV purposes to become compliant. Each of the 3 fiscal intermediaries are implementing EVV in a different way and on a different set of timelines. So you need to really work with your FIs. And I know some of the FIs right now are getting a lot of calls, and I've heard from family members, multiple family members, about delays with the FIs, but I know they are working very, very diligently to get out the information. So if we go to the next slide, we want to make sure that you all have the contact information. And again, like all of our presentations, this presentation will be posted to our DCH EVV website, so you don't have to furiously click and write stuff down, because this information will be available on our website for you to have at any point. So you have individual email contacts for every single FI that is available here. We are including as a link that will be on this presentation as well, a direct link to the previous town hall that was specific to your fiscal intermediary. So for public partnership and acumen, you can really get a look into the DCI system and the time for care system, which are their individual EVV systems that they're going to be capturing what is needed by the federal mandate. So this information will be available. If you have questions or concerns, I would encourage you to go back to these contacts. Sometimes you guys are sending them to the EVV mailbox or to me personally, or sending me text messages on my work phone or calling me on my work phone. You are still welcome to do that, but you're adding a step for yourself, because I am going to forward your information to the contacts at the FIs and ask them to follow up with you. So you can cut out the middleman of me by getting them directly. Now, I understand sometimes you guys go, well, we're just not getting the response we want. Well, I understand, like with all contractors, we listen to what your concerns are and communicate that, and it is considered in our contract management. So I understand if that's what your point is, but if I am your first contact in trying to address these issues, you are adding a step to getting the help you need. So familiarize yourself with these contact resources, please. Okay, that will be the end of the self-direction update. You're welcome to stay if you want, but we'll be moving on to what is more targeted to traditional providers. I want to once again go over the key fob information, because I continue to get the questions about key fobs as well. So we have decided that we are not going to be using key fobs or fixed devices. And we really did that because it's no longer an industry best practice. We are going with the application that is available on smart device. For folks who do not have a smartphone or have a religious reason why their caregiver doesn't use a smartphone, or there may be a medical reason why the caregiver or the member doesn't use a smartphone, we do have available IVR. You can request to use the telephone in the member's home. It does have to be a hardline telephone that is affixed to their address. But if you don't have that smartphone, you can get that IVR. In addition to that, there are free smartphones that are available for members. And I have had this conversation probably with 30 or 40 families and members at this point. GA Lifeline, through this link, provides a free smartphone for Medicaid members. It has unlimited texting. It's not provided by DCH. It is a federal program, but all that you have to verify is that you're a Medicaid member. You get a free smartphone. It has unlimited text and unlimited talk, and it has way more data than is necessary to run EVV in a month. Way more data than is necessary to run EVV in a month for free. So if you can't meet the first two conditions, your member can request a free phone and use that phone only for the purposes of EVV. Their worker can do their individual login and password and use that phone to sign in and sign out for the EVV program. Next slide, please. So where are we? Status updates and timelines. As many of you know, we took in your considerations, your comments, your questions, your concerns, and we pushed back the mandatory claim submission date from July 1st to October 1st, 2021. However, we are establishing actionable steps between now and October 1st because we don't want folks to just not participate and think that we're going to continue to push this date back, because leadership has been very clear. They want no further pushbacks of the claim update date past October 1st. So what does that mean for you all? The next big milestone is July 23rd, 2021. All traditional providers must be registered by July 23rd, 2021. And of course, your next question is going to be, well, what happens if I don't register? We're going to put you on prepayment review. So you're not going to get paid. All you have to do is register for the Tellus system by July 23rd, 2021. If you register by July 23rd, 2021, you will not be put on prepayment review. If you do not, you will be placed on prepayment review. The next step past that is August 31st, 2021. What is required by that point is that your employees need to be input into the EVV system, and you have to submit at least one claim successfully. Sorry, the garbage people are here and they're driving by right now, but they're gone now. Sorry, y'all. So you have to have all your employees input and at least one claim successfully submitted by August 31st. So that gives you 5 weeks to put in all of your employees, have a caregiver have their schedule in, clock out, and submit that claim through EVV. What happens if you don't do that by August 31st, 2021? You will be placed on prepayment review, which means you will not get paid for your claims until we as a department manually release those claims. So that's your second step by August 31st. And then on October 1st, we plan on implementing that mandatory claims edit, which means all of your claims, all of your members, all of your PAs will need to go through the Tellus system, whether that comes directly from you or from a third party to Tellus. We will need to have everything implemented by October 1st, 2021. We'll be putting a hard edit onto the EVV system at that time. Next slide, please. So we want to talk a little bit about the benefits of EVV, because we've heard a lot of concerns, and we really appreciate your concerns. We take all of your concerns very seriously, and we do use that to inform the system. But we have also, through some of our surveying, heard some benefits, and these are direct quotes from providers who are using the EVV system. They have said things like, hey, I like not having to approve time daily. I like not having to submit time sheets. We have some providers that have been using an EVV for years, and they understand the benefits of it, minimizing scheduling and visit verification information. And another big thing we hear is that caregivers are more accountable. And as an agency, there is a lot more accountability and streamlined billing process. So I want to pause here 1 second too to tell you we appreciate these positive highlights. And again, we also appreciate your concerns and comments that have been stated. But I want to have a pretty transparent talk as I normally do. You know, I'm pretty forthcoming for those of you who know me and just not very good at government speak. So what we have also seen from some providers and some family members, and not the majority, but in a limited capacity, is what I'm just going to call unprofessional behavior. We have had providers that have used foul language, just cursing and screaming. And I've had texts to my personal phone that would be considered threatening. If I was a younger person and hadn't been doing this for 25 years, I might actually be somewhat concerned about it. But that is not going to be tolerated. So I want to be clear about that. Non-professional behavior is not going to be tolerated. So providers do operate under the Part 1 Policy and Procedures Manual at the discretion of the payer source, which is the Department of Community Health. So I am going to challenge and encourage you to maintain a professional demeanor when you're addressing anyone, whether it be at the department or one of our contractors such as Conduit or Netsmart. We understand that change is hard. We understand that this is a big lift, which is why we've been talking about it for 3 years. And it's also why we postponed the mandatory claims date for 3 months. But we also have concerns about how our members are treated, including health and safety, if what we see from a provider is unprofessional behavior, right? So there is a direct correlation between the way you act and the quality of care that our members get. And the Part 1 Policy and Procedures Manual is very clear about the department being able to take corrective action, including termination of providers that has behavior that is unprofessional and unbenefiting the agency or member. So again, this is not widespread. The vast majority of our providers have been very, very professional, cooperative, great input, great questions, helped us benefit the program. But I do want you all to hear, for that small minority that is struggling with professional behavior, that we will not just continue to allow that behavior to exist within our provider community. Thank you. Sorry, next slide. So EVV training. This is a reminder that training is offered through the Netsmart website and really should be completed based on your role at the provider agency. If you're using the Netsmart EVV system and you're an administrator, you should, at a minimum, be doing the administrative console, mobile application, claims console. Providers who are using a third-party EVV should be doing, administrators should register and complete the claims console training, but the caregivers and aides do not have to complete the training. The caregivers and aides on the Netsmart side who do not have that administrative functions do still need to be on the system, register, and complete the mobile application training so you know how to use the mobile application. If you're using the third-party system, those caregivers need to work with your third party on using the clock in and clock out for that. And again, all of these trainings are not part of the town halls. They are available on the Netsmart website. So your next question is, well, where's the Netsmart website, right? So this is a link to it. So we took that into consideration. So you can click on here, and as you see, there will be webinars associated with Administrative Console, Claims Console, mobile application, and getting on extra topics. So there is all kinds of training materials here. I sometimes will go in and look at the pre-recorded webinar. I have reviewed them all. but I utilize this website myself when I want to refresh, or when a provider has sent me something and I go, wait a minute, is that the way the system works? I use the webinars to go back in and look at those trainings. Next slide. So you have a question that the training did not cover. They have a live Q&A session, and this is available also on the website. This is one of those things that I think is incredibly underutilized that Netsmart has available for their providers. They essentially have an open session like we do at the end of this meeting, where, hey, I've looked at all the webinars, I've done all my training, but I still got questions. I still got things that I don't feel like their webinars and their recordings answer. Great. Go to the Q&A session and ask your specific question and get a specific answer. That is a resource that is available for you. Again, not part of this town hall, but part of the ongoing training resources that is made available from Netsmart. So there are guides to help you understand training and how to register. We have EVV checklists that are available on our EVV website. And all these are available on the website. Again, if you don't, I don't want you to have to write all this down. So if you go to Google and put in DCHGA EVV, it'll be the first thing that pops up. You can go to the provider tab and you can get into your training registration and how-to guides on there. And we have heard incredibly good feedback as part of the checklist that we have developed here that give you kind of a 1, 2, 3 of what you need to do to get started and get going. So that is in both the member section and it's in the provider section, where there are getting started registration and toolkits. So, and the other thing is, once you get registered for Netsmart, you don't even have to go through the website. You can get to the guides and short refresher videos, which includes printing from your portal. There's a little click over there on the dashboard that says trainings. And then you can have all those guides available for you as well as part of training. So that is yet another training resource that is made available by Netsmart and DCH, with Netsmart as our contractor. So I want to go through a few common questions, and then I think we turn it over to Joe to do some demonstrations. So we've been through the claim submission deadline that we have moved that out to October for mandatory, but a lot of you guys have asked, hey, you know, when do I have to submit claims to make sure they are paid? So the payment cycle in MMIS hasn't been changed, but that payment cycle runs Friday at noon for GAMIS. In order to meet that Friday noon GAMIS claim submission, you have to have your claim submission into Tellus by Thursday at midnight. Because at midnight, we send a file over from Tellus, Netsmart, to GAMIS to run those claims for Friday at noon. So we did have a couple of people who wrote us and said, hey, I utilized the Netsmart system at 11 o'clock on Friday and I didn't get paid. What happened? Well, you did get paid. You just got paid the next week because the file runs at midnight the night before. Missing members or authorizations, we continue to work on this. The vast majority of the time when it comes to missing members, and I mean 95, 96% of the time, we are finding those missing members are either not yet approved for a PA for services, so they're not showing up in our system. Maybe they're what's called PMAO, or they're waiting for DFACS to do their eligibility determination, or they are actually available in your system, but you're looking in one location and they're in another location. They're in your B number, you're looking in your B number and they're in your D number. But again, whether it's missing members or missing authorizations, you can call the call center and we will help to walk you through that. If there's a problem, we open a ticket so we can do the research to make sure that there's not a system or a systemic issue. The other thing I want to talk about is rounding rules. Boy, have I gotten a lot of questions about rounding rules. So let me tell you how the system is set up now in GAMUS. If you are billed on a 15-minute unit and you submit a GAMUS claim for 1 unit, that means 15 minutes. If you submit a claim for 1.1 or 1.05 units, meaning 16 minutes of units were done, or 15.5 minutes of units were done, that rounds up. That rounds up right now in GAMUS. That's the way we are currently configured. And I understand what has happened apparently for years since we started the program, was that providers were just kind of doing their own rounding to the 15 minutes. And trust me, I understand why. The example I always give is, let's say somebody has an hour authorized Monday through Friday, right? But if you go an hour and 1 minute on Monday, that's going to round up to an hour and 15. If you do the same thing Wednesday, Thursday, and Friday, you don't have any units left on your PA for Friday. If you go over by 1 unit Monday through Thursday, those 4 units take up all your unit for Friday. And now your member gets mad at you, right? Because they're like, wait a minute, I only got 4 minutes of service and now I don't get any service at all on Friday. So that is very important that, we have that conversation with our staff. The other thing is that the Department of Community Health is going to be establishing in short order, probably starting next week, rounding rules that equate to Medicare. And those Medicare rounding rules basically say at 8 minutes or less, or actually more than 8 minutes or more, and we round up. Less than 8 minutes, we round down. And that is standard Medicare rules. We've just got a few more conversations that we have to go through and some system look at, but that is our plan for now, to establish those rules into EVV to equate what Medicare does on the federal level. Next slide, please. Okay, I'm going to be quiet for a while, which is good because my voice is starting to fray. And I'm going to turn it over to Joe Schnurr, who you guys know from Netsmart.
All right, thanks, Brian. Hello, everybody. Hope you're having a great week so far. So there are 3 topics on this slide that I am going to demo for you. So let's review them first. So the first one is toggling between provider IDs to find Medicaid members on your dashboard. So I'm going to show you what it means to go between different, what we call locations that are tied to different Medicaid IDs. So what we've noticed is a lot of the providers have multiple Medicaid IDs. Typically, they're associated with a different program. And when they go looking in one program, they're like, oh, my member's not here. But really, that member is in the other program. So if you toggle over, you will then find that member. Now, if the member is in the wrong program, that's a different problem. That's how the data is come over, and we would need to make a correction there. But sometimes you forget, you're looking in one location when really that member is associated with your other Medicaid ID. So we're going to show you how to toggle between. Now, it can get confusing if you have lots of different Medicaid IDs. So we allow you to create a short name, and you can use any name that you would like. And this is to help you that when you're toggling, you create a name that you understand. So for example, if you're ABC agency, you might put ABC-source associated with a certain Medicaid ID, because that may be the Medicaid ID associated with the source program. That's just an example. So it's up to you to name it what makes the most sense for you all. So I'm going to show you how you can edit that name. And then the third item on here is about resetting passwords directly from the portal. So a caregiver, if they forget their password, they can reset their password directly from the mobile application. And it's pretty easy to do, and we've got tons of training to support how to do that. However, there could be scenarios where the administrator wants to reset that user's password for them. And I'm going to show you how to do that. Okay, so I'm going to exit out of the PowerPoint. So give me a second.
While you're doing that, I'm gonna just remind folks, because it's kind of the first comment and question that is in our mailbox, is that, hey, we're still not seeing all of our prior authorizations and our procedure codes. I'm gonna ask again that you inform the conduit, the Netsmart call center on that, and we'll have those resources because we do research that and open a ticket for it. Sorry, Joe.
No problem. Thanks, Brian. And can you see the screen okay, Brian?
I absolutely can. Thank you.
Okay, great. So what you're looking at is the administrative portal, which if you're an administrator and you've already registered, you should be very familiar with this portal. And I am logged in as a administrator in my demo system. So you can see we made up a name, Peachy Home Care for Georgia. And since we Tellus or Netsmart, we work across multiple different states, my drop down looks like this. And again, these are all demo environments, made up names. So we have a different demo environment for each of the states. So you can see we have one for Pennsylvania and Florida and so forth. So these are my names, and I've created short names so that I know which one I want to be part of. So I'm in the Peachy Home Care for Georgia, but if I want to jump over to my behavioral care for Florida, I just click on that. It says you're about to change providers. Okay. And then it resets me into my other portal. So again, if you have multiple Medicaid IDs, you have to register separately for each Medicaid ID. It's going to create a separate portal to keep that information separate. And then if you're an administrator and you have access to multiple, because not everybody will have access to all of your locations, that's up to you to decide. But if you are an administrator and you have access to multiple different locations, the way you keep all that straight is through these short names and then this drop down. And that's how you go between the different locations. So, okay, how do I create or alter these short names? Because when you register, it will assign a short name based on your agency name, but that may not be the best short name for you. So we let you edit this short name in the portal. So once you register and you get signed in and you're in your dashboard, you come down here to billing provider. See on the left-hand side menu, it says billing provider. I'm highlighting over it. When I click on that, the first thing it does is it brings me up the details about my agency. And you can see that I have my short name, behavioral care for Florida. Now you can see this little pencil icon here. And as I hover my mouse over it, it says edit. Well, if I click on that, it brings up this screen. And then it allows me to change that short name. You can see it right here. And so I'm not going to change mine because I like this one. But if I wanted to, I can just click on here and change this. Change this name. And then I would hit update. And then now my name will be renamed on my portal. So I'm just going to cancel out of this, but this is as easy as it is to change the short name. And you can change the short name anytime. So maybe you create a name and maybe later on you say, I don't like that name. You can come in and change it again. It's not a problem. Okay, so that's how you change it. We went over why do you want to change it. So in my drop down, I know which one, I don't get confused, and I make up a name that makes a lot of sense to me as an agent, as an agency admin looking across multiple locations. Okay, so if you have any questions on that, please drop it in the Q&A and we'll answer those for you. The last item was how do we reset a password for a user? So I'm going to go now to the user tab. Again, over here on the left menu, you see users. And again, in the training, you learn how to do all of this. And there's even videos on how to do these things. If you all may be still confused, even though you went through the training, I'm going to show you. So here's my users, and you can see the first one on the list here is Fernando. And let's say Fernando, he is a new user, and he called me and said, hey, can you reset my password? I forgot it. And even though Fernando could reset it on his phone, it's very easy. You press a button that says password help. He called me and asked me to help him this time. So not a problem. I can click on these three dots over here on the right, all the way on the right hand. So I'm just kind of circling it with my mouse here. If I click on those, I get a drop down. And you can see that it says reset user password. So if I click on that, it's going to reset Fernando's password. So I'm not going to do that to Fernando. But if I wanted to, that's as simple as it is. Click on the three dots, click on reset user password, and then they'll get an email about reset with a new temporary password to sign in with. And then when they sign in, they'll have to create now their new password. So very easy to reset the user's password. The other time that you will use this is when you load your users the first time. They only have 48 hours to use that temporary password to log in. And if they don't do it within the 48 hours, you're going to need to reset their password. In fact, here's a good example. See Mike here, Mike Bonito. See how his status over here? So there's this invite status. See how it says invited? That means that I invited Mike to join my agency, but he hasn't done it. If he did, it would have turned to accepted like everybody else says. And if it's been more than 48 hours, Mike won't be able to accept it anymore because the temporary password has to have a short life for security reasons. So then if Mike, he's going to call me if it's more than 48 hours and he's going to say, oops, I forgot, I never followed up. Can you please reset my password? I'll say, no problem, Mike. Are you going to be able to sign in the next 48 hours? Yes, I will. Okay, great, Mike. I'll reset your password for you. I click on the three dots. I hit reset user password, and Mike should be good to go. So that's a very common use case where the admin is likely to have to reset the password from the administrative portal. So hopefully that gives you a quick demo on some common questions that we get. And again, if you have any questions on those, we're happy to take those. I did want to just, again, Brian already went over this, but I just did want to show you the training tab is on here. I am amazed that we talked to providers that have been using the tool for a while and they're like, oh, wow, I never noticed that training tab. So if you click on that training, it says go to training. And when you click on that, it opens up a new browser, see training resources. And when I go to this tab, it gives me all my tools for success, user guides, video tutorials, FAQs, recorded webinars. So the training webinars, if I forgot how to get to those, they're right here where I can sign up for the even the live webinar that Brian told you about that we do once a week. And I really do encourage you to use that as a tool. Not many people show up to that call. So if you do, you'll almost get one-on-one treatment. And that we do that, I believe it's every Tuesday, we do those calls, and we'll do them more. If lots of people show up, we'll add more. But I can tell you that right now, nobody's really showing up. So again, that's a tool that is at your use, and we do encourage you to use that tool as well as all the others, the user guides, the tutorials, the DCH EVV website is loaded with user guides as well. So we've tried to create as many tools as possible and communicate it in many different ways as possible. So hopefully that helps you be successful with EVV. Brian, there was one other thing that I wanted to share, which is around the rebranding. So are you okay if I go over that real quick?
Yes, please.
Okay. So every other week, we will release some updates to the system. And it usually happens on a Thursday, which tomorrow happens to be Thursday, and we are doing a release tomorrow. And one of the things that's going to change is the logo. So if I go back to my portal, and you probably don't even pay attention to this, but there's a Tellus logo over here up at the top. It doesn't do anything. It's just a logo for the company name. And as many of you have heard, is that Tellus is now Netsmart. And so we are going to rebrand. We're actually not going to call it Netsmart. We're going to call it Mobile Caregiver Plus, which is the product name. And so we're going to do that release tomorrow evening. So when you log in on Friday on your portal, the Tellus isn't going to be there anymore. And it's going to have Mobile Caregiver Plus. Now, again, most of you probably won't even notice it, but I just wanted to alert you that that's happening. Now, we're also going to be changing it on the mobile application. And this is more noticeable because, as we all know, when we go to click on a mobile app, we're used to a certain icon. And today, the icon is that it says Tellus EVV. Well, if you're a user using the mobile app, after we release the update tomorrow evening, the next time you go to log in on your mobile app, it's going to say you have to update the mobile app. And we do this pretty frequently. There's other reasons we do updates to continue to improve the mobile app. And every time the users are forced to do the update. Otherwise, what we found is if we don't force them, guess what? They don't do the updates. And then what happens? Then they start having problems because they're on an old version. And then they're calling support and everybody's frustrated. So we force them to do the update to make sure you stay on the current version. In fact, most phones these days will have automated updates. So it pretty much does the update for you. But if it doesn't, when you log in, you will be forced to do the update. And when you do the update, it is going to change the look of the logo on your mobile app. And so I wanted to mention that because you might go searching going, hey, where did my Tellus EVV app go? Well, it changed to Mobile Caregiver Plus. So we created a website and a guide to walk you through all of this. So here's the website. And we can drop this in the chat on this call. So all of you can go to this website. You can click on it in the chat and you'll come to this page. And it walks you through everything that I've just shared with you. And it even has these user guides, one for Apple users, one for Android users. And if you click on that, it opens up this nice user guide. And it walks you through everything that you can expect in using this user guide. This is what the icon's going to look like. It shows you step by step what I do. So this shows, I click on my Tellus EVV mobile app, I go to sign in, and it says, oh, you got to do an update. Go to mobile app store, you go to the app store, you hit the update. And again, those users that have been using the app for a little bit, they've already went through updates. So this is no different than any other update, other than it's going to change the logo. So again, I just wanted to make sure that I called your attention to this website. I do highly encourage you to download these guides, share these guides with all your caregivers. We have also been sending out messages in the application. So again, some of you might not realize, but on your main dashboard, if you scroll down, there's this inbox, and we can send messages to our providers through this inbox. And we have been sending messages letting you know that this branding update is coming. In fact, we sent out another one today and saying it's happening tomorrow. Please go to this website for all the information, including the user guides. So hopefully all that makes sense. Again, if you have any questions on this, please do share those in the questions. All right, let me see if I can get back onto the PowerPoint. And Brian, turn things back over to you.
Great. Thank you, Joe, for all that information.
Mhm.
Again, the next slide is just to give you the EVV conduit call center resources. There is a phone number, there is an email, and there is also a website where you can do direct chat. Any of those resources are available to you. Next slide, please. So we will have August town hall meetings as well. We'll probably have one in September too, but for right now, we have August scheduled for August 8th. August 4th and 5th. We always do one during the day and we do one at night. We have one, I believe, Thursday of this week, tomorrow night, at 6 o'clock as well. We're just going to post this up. This is where all of the alternate EVV vendors are at this point. We have quite a few that are in production and quite a few more that are in pilot. The arrow here continues to move over to the right, which is great. We do want to point out those at the bottom that are declined integration. If you are a provider that has this as your EVV provider, you are going to want to reach out to that third-party EVV provider and ask what is the plan if they are not going to integrate, because come 10/1, you'll need to be using the Tellus system for CLS or PSS, or you will not get your claims paid. Now we are at the Q&A section, and you'll see here that we have up the conduit EVV email box, because the vast majority of questions really should go there. So we're trying to redirect those there. We do have the GA EVV mailbox that is available on our website and all the other presentations if you want to continue to use that one as well. Okay, I know we have limited time. We're down to about 11 minutes, but I'm going to try and run through as many questions as possible. We answered the first one, which was what to do if you still don't see prior authorizations. You need to call this call center number so they can either figure out what the issue is or connect you to where they are and under what system and what member, or open a ticket if it is a systemic problem. The next question is what caused the 10/1/21 EVV bulletin for delayed claims sending? That was a decision the department made at their discretion. The next question is, so workers can clock in through the Lifeline phone? Yes, they would just put in their ID on the app as well as their individual password. So you would essentially just go over it just like you do for, if we did use fixed devices, you would use it just like you would use a fixed device for that Lifeline phone for the member. Please go over the hard edit in place for 10/1/21. is that occurring on the GA website? It is occurring in GAMUS. There will be a hard edit that says claims for these procedure codes must be submitted through EVV, and that will go into effect 10/1. August 31st, the deadline is for 1 claim per employee or 1 claim per provider. All we are asking is 1 claim per provider ID, not per employee, but provider ID by August 31st. But keep in mind, everybody, it behooves you to get on board with the system as soon as possible, because the quicker you get on board with the system, the quicker you can identify if there are any issues, concerns, if you can't find members, if you can't find IDs. So it does not help you as a provider to work towards the date. It helps you as providers as much as you can. And I'm not saying that's what you are doing here, so don't take this personally. I'm just trying to encourage you to try and use the system as much as possible before that end date. Next question is, keeps us more organized, except we provide 3 to 4 individuals at one time and workers are complaining about verifying each individual again. Well, it is nice that, thank you for that input. It is nice to have some organization. So that is very good. We agree that's one of the good parts of EVV. I'm going to skip a couple of these because we have answered them individually. The next question that wasn't answered is that you have third-party software, and there seems to be some issues with folks forgetting to clock in and clock out. And will that be held against providers, looking at a provider's overall track record? So we use data analytics when our program integrity section and us at the Department of Community Health will look at the EVV system. If it is normal usage, everybody forgets to clock out. I've been talking about this for 3 years, that when I worked at a record store, I was terrible about clocking out. So we understand people forget to clock out. There's a difference between people forgetting to clock out and somebody not clocking out every single time they deliver services, right? So there are data analytics that lead us, and there are industry standards and data analytics standards that help states, and many states are already using them and using them quite well to identify areas where there is potential fraud, waste, and abuse, or potential training opportunities that are going to be out there. So no, it's not just individual, normal forgetting to do things. Everybody understands that that's just part of business. We are not receiving feedback from emails. So you can, I know that's not the EVV DCH email, because I respond to every single email that goes into that, specifically to the person's questions. So if you are having trouble receiving feedback, you can send it to that email box, and I will be happy to follow up with where you're having trouble with feedback from. And I know that that email box is caught up because it was caught up right before this presentation. So you can send that to either my personal email or the GA EVV mailbox, and I will follow up where you're having concerns about not getting responses that are needed. So please do that so I know if there's something we need to follow up with. If you're having concerns about payments, again, utilize this GA EVV Support Center if there are issues that you are seeing. That's very important that we have that documented so we can open a ticket if it is a real issue. Next question is, what is the date for rounding rules? We haven't established that yet, but we'll, like we communicate everything to you guys in full transparency, we will certainly communicate that as well. Skip a couple because they've been answered. What if the members' demographic information was loaded incorrectly? So we get members, this is a great question. Thank you for asking. A lot of good questions here today. We load all members' demographic information, including their address, from GAMUS. And GAMUS gets that information from the source eligibility system. So whether that be DFACS and the gateway system or the Social Security information, those are the systems of record for address and demographic information. If you need for that to be updated, it needs to be updated in those systems. Even if we were to override it in our system, what will happen is when an update comes from those source system, it's just going to override it because those are the sources of truth. I have told multiple family members who have called me and said, hey, my address is wrong. And I've said, well, this is what we have on file for Social Security. And they've said, oh no, we moved. Well, when you sign up for Social Security or Medicaid, you attest under the penalty of perjury that you will update your address within 12 days of moving. It's part of your rights and responsibilities for being a Medicaid member. You do it at every annual review and you do it at sign up. So it's really important that you're letting either Social Security or DFACS know of those demographic changes. The next question is a specific question about having two different provider IDs. So we will capture this question and we will have somebody at the leadership for Netsmart call you back on it. I know you've had several conversations with them, so we'll follow up with that one. The next question is, are authorizations figured on a weekly basis? That was just an example I was giving. Nothing has changed about the PA processing. So if PAs are calculated by the month, they will continue to be calculated by the month. I was simply using that weekly example as just an example, but it still holds true for a monthly PA, right? If you are going a unit over every single day, at the end of the month, you're not going to have any units, right? And that member is not going to get the service, and that member is going to wonder why they're not getting services, and they're not going to connect to the fact that it's going over. But no, nothing has changed about how we process PA units. The next question is another great question. How do we add another provider number? You need to register for each of your provider numbers. So yes, you will need a separate provider number for source than for CCSP. So if you have different provider IDs, they do need to be separate numbers. You can use the training resources we went over today that gives you step-by-step information, how to register an ID. If not, you can call the call center. Can I address that the EVV record is required to be sent to Tellus for Georgia within 30 minutes per shift ending? So that is a requirement. That's just kind of a standard interface requirement that we have. What are the penalties? There aren't any specific penalties with that. It could lead for delays for you getting paid and your providers getting paid. If a caregiver reaches at different times due to heavy traffic and the family and client consents that the time can be adjusted for the schedule to be extended for a few minutes per clock in. So you can always adjust the schedule, and we understand that there are times when people go over or under, and just as long as that's fully communicated and part of the process, there is absolutely no problem with that. So you don't have to definitely stick to the schedules. Yeah, that's not, and there's a couple of questions like that. So I'm going to ask that you not read into what my responses are here, folks. So I've said on a lot of different email, a lot of different town halls that we understand that schedules can go in and out or be less than more. But there's a difference between that and what we're not going to do is add units to the prior authorization. So it's important to understand that there is a correlation between sticking to the schedule and having enough units for a monthly PA or a weekly PA or a daily PA if you have a daily limit on your PA. If you go over, those PA limits will not change. All of the training websites are available in the chat and they're available online. I know we're running out of time here. So we will capture the rest. I don't see anything that isn't really addressed in the training. We will capture the rest of the questions and either do specific writes back, or you can email me and we will get that information out to you. Given that it's 2 o'clock, I want to be respectful of everybody's time. I again want to thank you for your continued participation and all the good questions and input. and I hope you have a wonderful rest of your day. Thank you.